Welcome to today's webinar, Key Considerations in LGBT Aging in Place and Care Coordination, hosted by SAGE. SAGE, or Services and Advocacy for LGBT Elders, is the country's largest and oldest organization dedicated to improving the lives of lesbian, gay, bisexual, and transgendered older adults. Our mission is to lead in addressing issues related to lesbian, gay, and bisexual and transgender aging. SAGE is headquartered in New York City and offers aging services throughout the New York City region. In addition, SAGE is the lead agency for the National Resource Center on LGBT Aging. SAGE has 29 affiliates in 21 states across the country. In 2015, SAGE started the National LGBT Elder Housing Initiative and ask communities to imagine a new reality. The initiative is a multi-year project with 5 key prongs focused on designing alternatives for millions of LGBT older adults to access welcoming LGBT housing in all its forms. The initiative has 5 prongs, including LGBT welcoming, senior affordable housing, training providers on LGBT cultural competency, working to change policy to guarantee fair housing protections of LGBT older adults, educating consumers, and expanding services, including best practices around aging in place and care coordination. Now let's look at today's objectives. Today's objectives include better understanding the demographics facing your local communities, understanding the additional implications of LGBT aging older adults, understanding the basic tenets of aging in place, and key considerations for your organization in partnering to ensure care coordination for all clients. It is estimated that there is as many as 3 million LGBT older adults over the age of 50 currently living in the United States. With the rapidly growing demographics of the baby boomer generation, this number could reach as many as 7 million LGBT older adults by the year 2040. In addition, 1/3 of households 50 and older currently pay more than 1/3 of their monthly income towards rent or mortgage. By 2024, this is estimated to reach 4.7 million low-income households with individuals 50 and older. Cost-burdened households often run the risk of not paying for other needed medications, transportation, or food. While the impact of housing discrimination within the LGBT community has been discussed anecdotally for some time, in 2014 these assumptions were confirmed with a formal study conducted by the Equal Rights Center. The study found that 48% of older same-sex couples applying for senior housing experience some form of housing discrimination. LGBT populations are not presently protected by the Fair Housing Act of 1968, and by and large do not have the same familial supports as their straight counterparts. In 2015, SAGE launched its National Housing Initiative. This initiative is comprised of a continuum of housing interventions for LGBT older adults. Whether it is providing cultural competency training to mainstream affordable housing providers, creating LGBT-friendly, affordable senior buildings, or accessing the tools to safely age in place and engage in supportive community services, the purpose of the initiative is to create a welcoming environment and provide choice to LGBT older adults to self-select the option that best fits their individual desires and needs. Aging in place is defined by the Centers for Disease Control as the ability to live in one's own home and community safely, independently, and comfortably, regardless of age, income, or ability level. Aging in place can pertain to a single-family home or a unit within a multifamily development, like an apartment building or condominium. Prior to the year 2000, less than 20% of any building developed had ADA compliance within its units, so a large number of our existing multifamily dwelling units will need modification assistance in the coming years to ensure they are safe living environments for aging older adults, especially with the growth in the older adult population with the aging of the baby boomers. It has been well documented by AARP and others that the majority of aging older adults currently prefer to remain in their existing residences to age in place, if at all possible. The number of households grappling with these decisions will only continue to grow, with the number of aging older adults estimated to grow to more than 77 million by 2040. 7 million of these will be eligible LGBT older adults. Aging in place is a trend catching on in many parts of the country. Focuses on changing an environment that can be made accessible in each room of the house to make it safer and more functional are not specific to any one community. Aging affects us all, and having interventions that are adaptable for communities will be important. Building of new units will never effectively keep pace with the growing demographics of aging older adults. As you see here, the costs are another big reason to consider aging in place principles. The average cost of assisted living in our area ranges from $4,500 to $7,000 per month. And buying into residential retirement communities can cost as much as $100,000 to $350,000, and in some communities this fee is non-refundable. AARP, as well as the National Association of Home Builders, provide certification training programs for providers to become educated in aging in place principles and how to provide modifications. Certified Aging in Place Specialists, or CAP certification, are individuals who are specifically trained in identifying and implementing home modifications. It is better to find someone who is certified because they understand more clearly what it is that needs to be done for the client to remain in their home. You can reach out to your local area agency on aging to identify organizations in your specific locality that have aging in place specialists. When thinking about whether aging in place is the appropriate option for yourself or a loved one, there are some key areas to take into consideration. They include 1. The physical space itself and whether it is conducive to aging safely. 2. The expense of your current housing situation. 3. The availability of transportation options. 4. The costs of various longer-term care. 5. The realities that come with aging in community, like the potential for social isolation. And 6. Care coordination and how to work with your healthcare team and loved ones to ensure you have the support needed to age properly and well in community. Asking yourself or the aging older adult that you are helping care for some of these questions can help determine if aging in place is an appropriate option. Home modifications can cost between $4,500 to $30,000 according to a recent study by MetLife. However, there are relatively simple modifications that can be made that are cost effective and relatively inexpensive. For a more detailed discussion around home modification, please see Sage's Key Considerations in Home Safety and Modification presentation. If monies are not an issue, there are a number of modifications you can make to a home to make it more age-friendly. Here are a list of key modifications that can provide additional safety in the home. For a more detailed look at home safety and modifications, again, please see Sage's webinar on key considerations in home safety and modification. Inexpensive changes like installing levered faucets or easy to grab cabinets or drawer hardware can improve the usability and functionality of a kitchen and bathroom. Grab bars in the showers and near toilets, bath benches, or elevated toilet seats and safety rails are also inexpensive interventions that can help create ease for someone aging in place. The following are key components to keep in mind around the physical space in your home environment. The first is flexibility in use. Some important things to keep in mind when we discuss best practices in aging in place on today's webinar are whether the design accommodates a wide range of individual preferences and abilities. A guideline or rule of thumb here is to provide choice in the methods of use, accommodating right or left-handed access and use, and providing adaptability to the user's pace. An example would be a light switch that has an easy-to-use lever to turn on and off. A second thing to keep in mind is simple and intuitive use. That means that the use of the design is easy to understand regardless of the user's experience or knowledge. A rule of thumb here is to eliminate unnecessary complexity. Be consistent with the user and in expectations and intuition. Arrange information consistently with its importance. Lever door handles versus doorknobs are a prime example of simple and intuitive use. The next is perceptible information. This means that the design communicates necessary information effectively to the user. A rule of thumb is to provide adequate contrast, maximize legibility of essential information and differentiate objects in ways that can be described by making it easy to give directions and instructions. Here you see thermostats that have large numbered information to make it easy to read for aging older adults who may have visual impairments. Additional items to keep in consideration is tolerance for error and the things that require low physical effort. This means that providing a clear line of sight to important elements for any seated or standing user and making the reach for all components comfortable for any seated or standing user. Accommodating variations in hand and grip size, and they provide adequate space for the use of assisted devices or personal assistants. Many communities have limited public transportation options. It is suggested that you research the proximity of public transit options in your area and also contact your local area agency on aging to inquire about possible transportation services that might be provided through your local area to alleviate the need for driving. Other options are things like Uber, Lyft, and other types of ride sharing programs, which can provide alternatives to driving in areas with limited public transportation. Something to keep in mind for those aging in place are the costs of long-term care. As an individual ages, the cost of care can be a primary concern. While the cost of care varies by area in the country in which you live, here are estimates based on the national median costs of care. For private nursing care, it can cost up to $87,000 per year. Home health care aides can cost up to $45,000 per year, and assisted living can cost more than $28,000 per year. As individuals age, social isolation can be a major concern that impacts the individual's emotional health and thereby their overall quality of life. Here are a few suggestions of ways to combat social isolation. Here you will find some suggested ways caregivers can assist in battling social isolation for loved ones. SAGE centers, which are located in 29 different programs in 21 states, sponsored by SAGE, are effective in providing active group activities for older adults to participate in daily. Volunteering is another great way to prevent social isolation, providing a sense of purpose, and available programs include things like Senior Corps or Retired and Senior Volunteer programs. Senior visiting programs are also another great way that many communities have adapted local versions of interaction between people of all ages to create intergenerational communication and relationships. Another growing trend is the use of technology. Adaptive technology, smartphones, tablets, or things like FaceTime or Skype to keep in touch and keep in contact with family and friends in other locations. The physical alterations you make to your home are important in increasing its potential safety. However, the added opportunity to coordinate services and care for those choosing to age in place is also important to ensure engagement in needed services and to avoid isolation and continue to build connections and community. Care coordination unites a team of providers to meet individuals' needs, improving healthcare access and outcomes, and synchronizing the variety of long-term services and supports needed for housing and overall stability. In these models, a care coordinator works closely with the individual, family caregivers, or the primary care provider, and other healthcare professionals to improve communication, resulting in improved individual well-being and outcomes for the aging older adult. In describing each of these components of care coordination, we discuss the potential challenges faced by small primary care providers in trying to deliver patient-centered primary care for patients with complex needs. Therefore, in some communities, a nonprofit organization funded by the local area agency on aging or other sources of government and philanthropic funding may provide care coordination case management. This is becoming more popular over time as it has been shown to reduce hospitalizations and keep people in their homes longer and increasing the overall health outcomes of the individual. To find out if an organization exists in your area that provides case management and care coordination services, please ask your primary healthcare provider or reach out to your local area agency on aging to find out specifics for your community. For LGBT aging older adult populations, the physical considerations for your home are no different than your straight counterparts within the aging community. However, the difference is ensuring that the care coordination you receive is culturally competent and makes you feel safe in engaging with a provider in your own home. The resources included here are excellent points of engagement to try and identify additional resources in your specific area around care coordination. They include the National Center for Lesbian Rights, and LGBT community centers and HIV service providers may also be good sources of information about healthcare providers in your area. If you can locate one culturally competent care provider in your area, you may want to ask that person for a referral to other kinds of providers. Here you will see that proper care coordination requires individuals to work as a team and with their care team as well as family members, whether that be your family of origin or a chosen family. This process can be time intensive up front, but can add a great deal of overall quality of life for the resident long term. Facilitating access to needed services include things like transportation, meals on wheels, as well as potential assisted technology or durable medical equipment like shower seats or grab bars. Additional considerations around care coordination include that the care providers assess activities of daily living, or ADLs, to gain perspective on overall needs of the tenant or resident. Available activities in your community as well as transportation options that are suitable for the resident and nearby. Identifying programming that may be provided through local, state, or government grants to your locality so that you aren't required to pay out of pocket is often recommended. Supplementing formal services with an informal care network made up of nearby family or friends can provide a great deal of added support and socialization. These are key components in care models like the villages or naturally occurring retirement communities, or often referred to as NORCs. Also, additional considerations around finances should be taken into consideration. You can compare health plans available in your area by using the Medicare Personal Plan Finder under the Find Out What Medicare Covers at www.medicare.gov or by calling 1-800-633-4227. You can also contact your state's Health Insurance Assistance Program, or SHIP, for help finding the SHIP in your state. You can contact NCLR or SAGE or your local area agency on aging. Again, informal care networks of family or friends is very important in overall care coordination. We are just beginning to see the use of technology within community-based settings to help individuals connect to their care providers and to others in community for socialization. It is certain that over time, these types of interventions will be utilized more fully, especially for members at the younger end of the baby boomer generation. You may have higher levels of functionality with technology. In many cases, the equipment or devices, iPads, tablets, etc., are donated through local philanthropy or government grants. One cost impediment thus far in the widespread usage of these types of options is internet availability. This is a socioeconomic disparity that many communities are beginning to grapple with. Engaging residents with community-based programs around social engagement through organizations like SAGE affiliates or other community-based programming can provide purpose and a space to socialize with friends and neighbors. Exercise is a key establishing positive baseline outcomes for patients around longevity and independence. Programs are typically offered by communities and focus on stretching, flexibility, balance, low impact aerobics, and strength training exercises. The majority of people enjoy good and excellent health even past age 85. Later life does not need to be a steady decline in health, but rather a number of healthy years followed by a much shorter period of ill health immediately before death. Enhanced fitness with programs like Matter of Balance or Tai Chi that are evidence-based have been proven to increase strength, boost activity levels, and elevate mood. While the decisions to age in place or move to an LGBT-friendly development or other more congregate settings is a personal one, there are ways to increase the safety of your home to provide greater stability to you as you age. Again, it is recommended to reach out to your local area agency on aging to identify local organizations specializing in aging in place and home modification. They will have staff skilled to make some of the more advanced modifications. However, things such as lighting, removing throw rugs, removal of clutter and loose cords, and the installation of grab bars can significantly reduce trip and fall hazards. The importance of remaining engaged in your own care as well as community based activities is important to prevent isolation and increase the potential for long term positive health outcomes. Case management resources, often identified through your local LGBT center, your local area agency on aging, or through your medical provider, can assist in connecting you to these resources. LGBT cultural competent providers are the primary component for our LGBT older adult community members in aging well in community. Thank you for joining us for today's webinar on aging in place. To find out further information, please contact Sage or reference our website at www.sageusa.com/LGBT housing. Thank you.